Well, I loved animals when I was a kid, and I wanted to be a veterinarian. And I worked in an animal hospital, and was working there on a Saturday, and the doorbell rang, and I opened the door. I was just cleaning cages and things like that, and here was a dog that was being held by someone who had found it on the street, run over by a car, and so I brought them in and brought the animal up to the operating room area and put him on a table and picked up the phone in the operating room and called the veterinarian and said, "There's this dog that's been hit by a car, what should we do?" And he said, "Well, where is the dog?" He said, "He's in the operating table." He said, "What? Why the hell did he get there?" And I said, "Well, I just brought him in, and so he came in, and we spent about 4 hours fixing the dog's broken bones up, and so that's how I got interested in orthopedics. I still wanted to be a veterinarian, but the veterinarians that I worked with were really of the opinion that it was better to be a doctor because you could do more for people than you could do for animals at the time. This was in the 80s or 70s, and so they wouldn't write me a letter of recommendation for vet school unless I also applied for medical school. And so I applied for medical school, and then I got into vet school, and then about a year after I got accepted to medical school. And so I decided to go into medicine at that time, and then never looked back. Always had a great experience with that profession, able to do a lot for people, things that we couldn't necessarily do for animals when they were injured because people didn't have the resources, or we didn't necessarily have the equipment at the time to do all that work. So it was it's been a very satisfying profession for me. And in retrospect, not knowing what I would have been in for had I gone the other route, so would have been good too. But yeah.